Hi there, folks. I'm Dr. Burke. I'm a practicing chiropractor here in Brooklyn Center, Minnesota, and I'm here talking to you today about how we successfully address people suffering with chronic thyroid disorders in our office using neurometabolic protocols. I've been practicing about 18 years, and over those years I've worked with a lot of people with chronic conditions, and almost always some sort of either diagnosed or undiagnosed thyroid disorder is part of the equation. And we're going to, as we go along here, I'm going to share about how that all ties in together. But really in this country, it's estimated about 21 million people, mostly women, are suffering with thyroid disorders every year. And the large majority are undiagnosed, which means there's a lot of people experiencing issues that they don't know what's the underlying cause to it. And it comes down to it, at the end of the day, the most important thing you can have in life is your health. You know, and today we're going to talk about a lot of different things. We're going to talk about how your thyroid works and what it's doing when it doesn't work. We're going to touch on some of the medical approaches, how they might work, and also many areas where they don't work. We're going to just go over how we approach chronic conditions in our office using a neurometabolic integrative approach, and then talk about some of the specific testing we do to work through the puzzles of a thyroid dilemma. And then also at the very end, I'm going to make a recommendation of the next step you can do to get yourself back on your road to being healthy again. And really, my underlying goal is I want to help you reinvent your life. You know, in life, you know, we have in many points in life, we have different points where we can make different decisions. And where we are right now in life, wherever it is a result of all the decisions we made. And what I hope to open up for you is some new turns in the roads and pathways you can choose to actually start to get your well-being restored. You know, because all we have is time. You know, life is short. The clock is ticking constantly, and life goes by. And in this country, you have a life expectancy. You know, we're born, and the average expectancy in this country is somewhere around 78 years. You know, there's things you can do where you can lengthen that. There's things you can do that can shorten that. And it really comes down to it. The average person lives about 4,000 weeks in their life. So you can just play a little game for a moment. You can look at how old you are, multiply that times 52, and then figure out how many weeks you've been alive for, and then compare that to the average life expectancy of around 4,000 weeks. And you kind of have a rough idea of kind of how many weeks you have left. And it's kind of a gulp moment for me when I did that. It's like, wow, I'm estimating, you know, about 1,000 weeks left for me. It's like, I'm not too impressed with that. But the reality is, you get to say how that goes and how you want those weeks of your life to go. Do you want them to go in a good way or a bad way? You know, you do have some say in the matter of how that goes. You know, how many weeks do you have left? And, you know, I recommend at the end of this, you go to a website called lifechangingcare.com. I'm connected with a network of about 800 other chiropractors in the country who we all look at cases the same kind of approach, through a neurometabolic approach. The nice thing is, if you hire me to help you, you also hire 800 other doctors, because we're constantly in groups discussing, chatting, bouncing ideas back and forth, because our overall commitment is we want to see people get better. You know, and in life, you know, when the attitude's right, the facts in life don't matter. Now, if you have the right attitude, you're going to get through whatever barriers are in your way for whatever area of life it is. So I want to have the maximum positive impact in life. In my life, my family's life, my patient's life, that's my commitment. At the end, I'll provide you with an exit strategy. What can you do? What things could you do to reduce or relieve your pain, your suffering, your health issues, so that you can actually experience those last weeks in the way you want to? But I want to be really clear about something. You know, I do not treat or cure anything. I don't treat or cure back pain, neck pain, headaches, carpal tunnel syndrome, sciatica, diabetes, weight problems, thyroid disorders. I don't cure any of those. That's actually, in this state, I can't say that, and that's not how I approach a case. What I'm looking at is what is the underlying cause of your condition, whatever you're dealing with. And in most cases, those underlying causes are inflammation, toxicity, and immune system breakdowns. We're going to talk about those as we go along here today. A lot of the work that I do in thyroid case is based on the work of Dr. Datis Karazian. He's the author of the book, Why Do I Still Have Thyroid Tests When My Lab Tests Are Normal? Or as one of my patients put it, it's like, Doc, my lab tests are normal, why do I still feel crappy? Please get to the bottom of this. LifeChangingCare.com, I mentioned a moment ago. And we're going to talk about at the end of this discussion, I'm going to make a suggestion for you, your next step. And there's going to be some rules for you to actually participate in that next step. One of them is that you're committed to getting better. You must be prepared to make some changes in your lifestyle. You must take responsibility for your own health. And you got to understand that insurance isn't going to be a big player in this. And I'll talk about how and why insurance works. And you must understand a really simple fact. You may or may not know this. Your thyroid issue is a chronic illness. Your body has been sick for years. Now you have a label. And with chronic conditions, often there's no complete recovery. The game often with many chronic conditions is improvement. More good days than bad days. And sometimes it's a lot of good days and a few bad days. Sometimes we're just looking for improvement in a person. See, all chronic conditions, whatever it is, have some common threads. Where you walk into my door and you're dealing with thyroid issues, or blood sugar issues, or fibromyalgia, vertigo, dizziness, peripheral neuropathies, arthritis, whether it's osteoarthritis or rheumatoid arthritis, or digestive issues like Crohn's disease, or irritable bowel syndrome, or insomnia. Whatever it is, there is an underlying cause. Those underlying issues are often things like anemias. And we'll talk about it later on, but anemias are a big player because your brain and your blood cells need oxygen. Your brain and your cells need oxygen. If you can't carry oxygen to your cells appropriately, there's going to be some problems. Also, issues like thyroid dysfunctions, unstable blood sugar, adrenal gland dysfunction, hormone imbalance, autoimmunity is a big player we're going to talk about a lot today, hidden infections, chronic inflammation, and also neurological imbalances. Not like your brain is bad, just your brain is not balanced and working as efficiently as it should be. I kind of put all those common threads into three categories: oxygen deficiency, neurological misfiring, and metabolic imbalances. Or put another way, we all are a web of physiology. We have all these different systems in our body working. We have blood sugar, we have adrenal glands, we have gut, thyroid, hormones, liver, immune system, brain, cells, mind, body, all working together. And when things work together in the right balance, things are good. If things are out of balance, issues can happen. In our conversation here, we're talking about thyroid disorders. But you can take any condition and put that in the middle. And we start looking at what are the other parts of the web causing those issues, causing that problem. Today we're talking about thyroid. So we're talking a little bit about the basic function of the thyroid. Something you may know, some you may not know. So we just want to cover the basics because the thyroid gland is a major player in your life and in your body. It supports a lot of stuff. It supports bone metabolism, immune system, hormone balance, brain and nervous system, gut and gastrointestinal function, bone growth, muscle growth, fat burning, blood sugar metabolism, a whole host of things. And when it works, it's good. When it breaks down, it can open up a whole lot of other issues that may be obvious thyroid and subtly connected to thyroid. See, the important part to know is that every cell in your body has a thyroid hormone. Every living cell has a thyroid hormone. And the key, by the way, I'm not sure if I said that right. I'm going to backtrack. Every cell in your body has a thyroid receptor. And a thyroid receptor attaches to thyroid hormone as it goes by and makes the cell do something. Turns the cell on or off, makes it do something. And the key to thyroid health is getting the right amount of thyroid hormone to the cells at the right time and having the cells react to it. It's getting just enough of the hormone inside your cell at the right time. And if you don't get that, you get symptoms. If you don't have enough thyroid hormone getting delivered to the inside of the cell, you get symptoms of hypothyroidism. Those are things like fatigue, weight gain, even if you're eating a low-calorie diet, depression, constipation, digestive issues, cold sensitivity, muscle cramps. poor circulation, itchy, dry skin, stomach pain, bloating, the brittle, dry hair, edema, brain fog. And by the way, any of this stuff can affect men also. It's not exclusively women. If you get too much thyroid getting into this thyroid hormone getting into the cell, then you get symptoms of hyperthyroidism. Those are things like heart palpitations, kind of a trembly, unsteady feeling, increased heart rate, nervousness, stress, insomnia, night sweats, difficulty gaining weight. And what we also don't know is about what's not commonly discussed, I'll talk about why in a few minutes, is that 90% of thyroid issues involve an autoimmune component. What that means is your immune system has gotten confused and now is attacking the thyroid. That's what we call a autoimmune hypothyroid or Hashimoto's thyroiditis. You can also go to the other side of the coin. You can get Graves' disease, where the thyroid is overactive and doing too much. But either way, the thyroid is being impacted by your immune system, and so that's so it turns into a very complex puzzle. Now, the reason it gets complex is the doctors don't test for this. Most medical doctors don't. In the medical world, they have one tool to work with. That's thyroid hormone for looking at the TSH. When it comes to dealing with the autoimmune system and all of that, they have very few tools to deal with that, so they don't test for it. So what that means is you might have a thyroid problem, but it's not a thyroid problem, it's an autoimmune problem. And that's often we see this where medications just don't work. How do I deal with that? We do a complete workup. We look at detox, we look at reducing inflammation, we look at the immune system. They might also be saying, but doc, my thyroid's gone. They took my thyroid out. They either did surgery and cut it out, or it was what we call ablation, where they destroy it with radiation or drugs. And that might be the fact. So we know we're never going to actually support you to the point where you can go to your doctor and say, I'm doing really great, let's get me off my thyroid medication. And we do that with people. Because that's how we actually work with that. If a patient asks me, doc, can I stop taking my medication? Absolutely not. Go talk to your medical doctor. Tell them how you're feeling, have him test you, and have him make that decision, because I don't do that. But you still underline that you still have an autoimmune condition. Your immune system is still attacking your body, and how the immune system seems to work is if it goes to one thing, it spreads to other. So it's almost always, we'll see if you, shall we say, cover up an autoimmune reaction one part of the body, it goes and attacks something else. Maybe it starts in the thyroid, then goes to your joints for rheumatoid arthritis, or it goes to your nervous system for things like MS or other neurological disorders. So you want to actually get down to the reason of why that immune system is freaked out and attacking your body. Might also ask too, what about things like armor thyroid? It's the same thing. You have an autoimmune condition. Plus it's T4, thyroid T4 hormone. We're going to talk about the importance of that in a minute. So if you're having conversion issues, it's still not going to help you that much. To understand thyroid problems, you really got to understand how the thyroid works and what it does. So, and how it interacts with your body. So one big part is the thyroid is a crosstalk. It talks to everything. Your thyroid gland talks with your immune system, and it talks to your gut and your GI system. It talks to your brain and your nervous system. It talks with your hormones and all your hormone systems, and those communicate back. So it's a two-way street. Each one affects the other. And how it all works, it's a real complex looking diagram. We're going to break it down in a minute. But at a real basic level, you got your hypothalamus, it's a part of your brain, talks to your pituitary by different hormones. But your pituitary does a lot of different things. It releases growth hormone, that's for tissue repair and tissue growth, and it's also kind of called the anti-aging hormone. As we get older, we make less of it. It deals with the adrenal glands, helping your body adapt and to handle stress. It deals with your the gonads, the testes, the ovaries for all that hormonal function, and it deals with the thyroid. So what happens is the hypothalamus talks to the pituitary by way of a hormone called thyrotropin releasing hormone. Don't worry about the name. It's just brain tells the pituitary to release TSH. And TSH goes down to the thyroid gland and combines with things like iodine and selenium and magnesium and other things to make a couple of hormones. It makes one called T4. That's the inactive form of the thyroid hormone, and that is also known as thyroxine. And that makes up about 93% of what your thyroid makes. The other 7% is what we call T3. That's the active part. That's the part that attaches to the cell and turns the cells on or off or makes them do things. So you got majority of it is the inactive form, small part is the active form. So now that T3 or that T4 gets carried by way of a protein called TBG, which is basically kind of like a taxi or a boat carrying the hormone down through your bloodstream, and about 20% goes to your tissues like your kidneys and other areas. About 20% goes to your gut, and 60% goes to your liver. And what happens in those tissues is that T4 gets converted into T3. And we're going to use the liver as an example here because it's the biggest player and it's one of the big areas to have an influence with. You get active T3, that gets freed up, goes out in the circulation, goes out to the cells, attaches to thyroid receptors. Remember, every living cell in the body has a thyroid receptor. Turns that cell on, makes that cell do something. So a quick review. Well, here's just the picture at the very beginning. It's all up here. If you start to look there, though, there's lots of places where this whole process can break down. We're going to talk about those. Now, the thyroid has what we call a negative feedback loop. When there's too much T4, then it goes up and signals the brain going, hey, we have too much T4. Don't release so much TSH because we don't need to make any more of it. So it turns the production down. And if you have the case where you have too much of that, you're considered a hyperthyroid person. And the TSH is going to be low, and they call that hyperthyroid. The other side of the coin is what we call a negative feedback loop. Oops, I got my sides backwards. I'm sorry. First one was the positive. Sorry, first one was negative. This one's positive. Term's not that important. Here's the basics. Not enough T4 in the blood. Brain goes, we have low T4. Why does it measure T4? Because that's the majority hormone. Not enough T4, well, brain kicks out more TSH to tell the thyroid, give it a kick in the pants to make more thyroid hormone. And if you have that kind of situation, then you are considered hypothyroid. And remember, as I touched on, 90% of people that are considered hypothyroid have an immune system component to it. Actually, about less than 7% of thyroid disorders are a true, we call primary hypothyroid disorder. We'll talk about that in a few minutes. So here, how do we start to unwind the puzzle? How do we start to get to the bottom of the dilemma? It's proper testing. Proper testing is key between success and failure. Dr. Krasny has a great quote. The greatest mismanagement of hypothyroid begins and ends with the blood tests. So here are some of the basics why it's a problem. You might go, Doc, I have blood tests. They said I was normal. They said I was fine. And here's the first flaw in the matter with that. Typical lab ranges aren't reliable. What happens is their ranges vary from lab to lab. And also, too, they use bell curves based on sick people. Because what happens is every couple years, all the labs compile all their data of all the tests they ran, and who very often goes in to see the doctor is sick people. So now they're looking at a pool of data from sick people, and they use that to determine what's considered the normal ranges. And then the other part with that, so then when we look at that, functional ranges are more sensitive. They're actually comparing you to where you should be healthy, comparing to healthy people, not sick people. And using functional ranging, you can actually start to see patterns before they turn into big issues. See how your lab test can be normal, but you still feel sick. Kind of expansion on this. Here is a typical lab range. And then if you're outside of that, you're either low, you're abnormally low, or you're abnormally high. And those are considered what we call a disease diagnosis range. You're far enough away from healthy they consider you have a disease. I like to imagine a target. Bullseye is perfect health. Off the target is some sort of disease, but there's a difference, there's a space between the bullseye and the edge of the target. That's where functional disorders take place, and that's this gray area. So if you're outside of functional ranges, but you're in the gray area, medical doctors will consider you normal. They say you're fine. but you're not healthy. But you just haven't gotten to having a disease process. So what it means is the doctors say you're sick. Say, yep, you say you're sick, but your lab tests are normal. There's not much we're going to do about it. We're just going to wait and see until it gets bad. And I'll never forget, a number of years ago, I had a patient came in, and she came in, her fasting blood sugar was 115. I said, wow, that's really high, because if you look at it, the cutoff diagnosis for diabetes is 122. She was 115. Normal should be under 100. I'm like, well, what's your doctor doing? It's like, well, nothing. They're going to wait until I get diabetes and they'll do something. And that just, to me, that's insane. To wait till somebody gets bad and they can put a label to it and they can actually do something. Why not do something before it gets bad? It's insane. So functional ranges, we start to assess the risk before disease actually fully develops. So here's some examples. I kind of touched on a minute ago. You look at blood sugar, glucose. Medical normal, 65 to 110. Functional normals between 85 and 100. So you walk in the door and they draw your blood and say, wow, you're 78. You're in good shape. That's actually hypoglycemic. You're going to be tired. You're going to be achy. You're going to be headachy. You're going to be crabby. You're going to have all those signs of a low blood sugar. Or you walk in and you are 105. Well, in that world, you're normal. In a functional world, you're dysglycemic, where blood sugar metabolism is on that trip down the road towards diabetes. And it can be intervened with at that point easily. So conventional medicine doesn't deal with these subclinical diagnoses at all. So how a typical case goes for a thyroid case. A typical thyroid test is ordered. Usually just TSH, maybe a T4, possibly. Based on that, so your doctor orders this very simple blood test, provides minimal information, which your insurance covers, and then with minimal lab results, then they do minimal treatment, which may be at a minimal cost at the time, but at the end of the day, who pays the price is you. You pay the price. You pay for it in the end. So people ask me as a doc, what about my insurance? Does insurance help with this? And here's the deal. Insurance is going to cover surgery. It's going to cover medication. But if you look in the 2013 Medicare manual, and I checked in the this is 2011. I checked the 2014 manual, it said the same thing. Now the Medicare manual is how all insurance companies base their structure. So it says here, and I love this, a treatment plan that seeks to prevent disease, promote health, or prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is not a covered benefit. So at the end of the day, what are they doing? They're keeping people in a situation in a state where they're not healthy, and they're calling that our health care. It's no wonder we're 37th in the world in healthcare quality, and we spend, I think lately, I read it was like over $10,000 per person in this country on their healthcare, and we're getting a pretty poor quality product. So you might want to start to ask yourself, is dependence on your insurance making you sick? You all have a car. We have auto insurance. The auto insurance doesn't cover the oil changes or the tires or the tune-ups or the maintenance on the car. It covers you when you smack into something in a trauma. But we are, you have yet to see my auto insurance say, hey, let's go in and get your oil change. We'll cover it. Have not seen that happen. So conventional medicine, and by the way, I want to take a moment. It'll sound like I'm bashing on medicine. I'm not. Medical care is very, very necessary. However, it really falls short in the management of chronic conditions. That's the shortcoming. I had for a couple of years ago, I had an issue where I hadn't been taking care of my well-being for a while, had a massive amount of stress, and wound up in the hospital for a week with pneumonia. Now, I needed medical care at that point. I couldn't breathe. Really, I could not breathe. And they got me out of that crisis. I needed some medication. However, even as I said, I was in there. So we know you have pneumonia, but we don't know why. Because I was asking, of course, I'm asking, why is this happening? They didn't know why, but I had to get out of that crisis. And I walked out the door. I could breathe again. Then I had to start getting after why it happened to myself in the first place. And I'll share more about that in a little bit here. So medicine is really necessary. I don't have a problem with medical doctors. There's some great, well-intentioned medical doctors. Where I have a problem is a system that they're in that doesn't allow them the freedom to actually treat people the way even the doctors want to. I don't think any of them, when they started down the road becoming a medical doctor, thought, well, my goal in life is to give substandard care to my patients. I really doubt that was it. Their goal in life was to help people. Just the system has limitations to it. See, conventional medicine is geared towards symptomatic relief and a cure with drugs and surgery after disease manifests. Here's one part here, drugs and surgery. This is my opinion, and I think it's got a lot of basis behind it. I think the drug companies do not want us to be well. They don't want us to be healthy. Because if we're healthy people, we're not buying lots of medications, and that's a problem for them. So I think, in my opinion, here's where I think the problem is, drug companies are dictating your health care to force them into using their product. That's just me, that's what I think. Functional medicine is geared towards wellness and prevention with nutritional and natural and lifestyle support before the disease fully manifests, or even catching people in disease state, but working in that kind of model to bring them back to being healthy. See, looking at it from the perspective of thyroid, treating the thyroid gland with hormone replacement therapy is a 50-year-old model. It's old, it's been around for a long time. And we've learned a lot about how the body works in the past 50 years. Sometimes it works. Actually, if you look in the literature, about less than 10% of the time it actually works. And I'll show why in a few minutes here. Or if it does, often it's noticed a short honeymoon. You feel good for a little bit, and then you slide right back. Some of the shortcomings, they're flooding your system with synthetic hormones. And those hormones they're in unnatural amounts, which can cause those receptor sites on the cells to become less active. We call it downregulation. It's kind of like if you're in a noisy environment with lots of kids around, you can tune out all that noise, and you just don't hear it. And then you might miss your kids saying something because it's just all that noise you've tuned out. That's when the thyroid downregulates. It's just ignoring the information. It can cause the gland to slow down or eventually stop production. Can cause poor liver breakdown and elimination of hormones. The liver gets backed up with all the hormone byproducts. And most synthetic hormones don't show up on blood tests. So we have an inaccurate measure to work with. And HRT is only going to keep the TSH in a normal range. It assumes the thyroid's the only problem, which often is not the case. We're going to expand on that in a minute here. So after years of treatment, you might be asking, well, why are you not feeling better? And often if you go talk to somebody, they say, well, not better, maybe it's in your head. Maybe you're making this up. Or maybe it's because you're lazy. Or maybe you just need to go get a little bit of exercise, get out more. All a good idea, but it's not dealing with your issue. Or maybe you're just really in your head and you need medication to fix your brain. Or maybe the ball's been dropped in management in your case. And we're going to talk about how we manage a case here. And by the way, that dropping the ball is the big reason why you're still not feeling well. So what makes us different? What makes us different is that we approach our patients from a combination of metabolic and neurologic therapies, or neurologic and metabolic case management, starting with a complete thyroid panel. So a complete thyroid functional test. If you go in and see a medical doctor, you'll get a TSH, you might get a T4. We add on things like a free thyroxine index, free thyroxine. Explain all these in a few minutes here. Free T3, reverse T3, which resin T3, TBGs, TSH antibodies, and TPO and TBG antibodies. We get a much bigger picture of the equation. We get to see more information. When you have more information, you can make better choices. Briefly, in my previous slide, I mentioned things like Hashimoto's, which is hyperthyroid, and Graves' disease. Hashimoto's, which is hypothyroid. You can do both. And Graves' disease, which is just a straight hyperthyroid. Those almost always, over 90% of the time, are not strictly a thyroid issue. They are an immune system issue. Your immune system is attacking the TPO and the TBG and the TSH enzymes and hormones, and they are immune problems. You have an imbalance in your immune system needs to be addressed. We need the proper testing to figure that out. We can't just throw more TSH at you. You're not going to get better. Why would your immune system do this to you? Your immune system is there to protect you. It's there to protect you against foreign invaders. Why does it do this? And kind of a real brief picture of immunology. I'm going to use, this is very simplified, but I use an analogy of like a medieval kingdom. You've got the king sits in his castle. The king is called TH17 if you care. But the king's in his castle, he sets the policy for the kingdom. He's setting who the good guys are, who the bad guys are. Then on the wall of the castle is the general, also known as T3. And his job is to take the policy of the king and enforce it throughout the kingdom by way of his foot soldiers, what we call TH1 and TH2. So the foot soldiers are the TH1, the TH2 are the archers. They're out there, they're protecting the kingdom based on the policies of the king. Now the system can break down a lot of different ways. You can have incompetent foot soldiers and archers out in the field. You got a problem. They can be attacking the wrong people or ignoring a foreign invader or whatever that might be. You can have the general up on the castle wall. He's incompetent. Can't give the right orders. That's a problem. You can also have the king who's gone nuts. And that is really where that autoimmune conditions come in, where just the wrong orders are coming out. The whole system's confused and breaking down. So when I look at a client and a patient, we assess all three of those areas: the king, the general, and the troops out in the field. Almost always I'm starting back trying to fix the king in the castle. And there are simple ways that we do that. So why would your immune system do that? Partially it has dysregulation, blood sugar. When blood sugar is not being controlled, you get lots of different issues. You have insulin going all over the place. Insulin is inflammatory and affects the gut and the immune system, the brain. It affects lots of different areas. Exhausted adrenal glands. Our adrenal glands help us adapt to stress. We live in a very high stress environment: mental stress, chemical stress, physical stress, electromagnetic stress. All of that wears our system down. When we're under stress, we burn through massive amounts of big and micronutrients. And if we're burning through our stores, we don't have it there to run other things in our body. Hormone imbalances, neurologic imbalances. I'll talk about those in a little bit here. How do we determine where to work? We do the proper testing. See what part of the puzzles we work with. We got to look, is there an active antigen? Is there an infection happening? Part of what took me down with my pneumonia, I determined after some investigation, was Lyme's disease. I had Lyme's disease for a long period of time. It had been very dormant, but with high stress, that infection came up and took out my lungs. But it can affect a thyroid. It can affect other areas in the immune system. You have chronic, so you can have active antigen. You actually have something there that your immune system is reacting to. You can have chronic infections like a bacteria or a virus or a mold. You can have parasites in the gut. Food sensitivities are a big player. If your body's having an immune reaction to a food, that's a constant stressor on your immune system. And combine that with a leaky gut. And the analogy I like to use for a leaky gut is, imagine that the walls of your gut are like all these cells joined together in very tight junctions, protecting you from what's inside your intestinal tract. If things happen to cause those junctions to get bigger, large particles can get over into your bloodstream. Now your immune system has to attack them. So say those large proteins are wheat molecules, or a corn molecule, or a dairy molecule, or soy, or whatever it might be. Immune system starts to react to it, and now you start to create an immune response to your food, and that's a problem. Environmental toxins. We live in an incredibly toxic environment. Last I read, there's like 13 billion pounds of toxic compounds are pumped into our environment every year, and we know about what less than 10% actually does, and that 10% is not good. So we have a huge toxic load in our system. Undigested food that leads to that leaky gut I was talking about a moment ago. Heavy metals, that can come from things in the environment, that can come from vaccinations, that can come from our food supply, that can come from silver fillings we have in our teeth. How do we get to the bottom of it? Proper testing. We ask the right questions. Ask the right questions, we get the right answers, we can do the right approaches to deal with it. Hashimoto's is the #1 cause, but there's other factors that can lead to hypothyroidism. And here's where we're going to get into some of the real basic, the 6 major thyroid patterns, how the thyroid breaks down. So one is the primary hypothyroidism. This is the one pattern that does respond to TSH. So even if you have primary hypothyroidism, we can still help you, but we just know that you actually have a true hypothyroid. Unless there's an autoimmune component to it, and then whatever you do is not going to work. But it's just purely, strictly, the thyroid isn't working for whatever reason it is. This is the one area where TSH hormones are going to work, and that's where the pituitary starts to try to give the thyroid a kick in the pants to start working. That's by pumping out more TSH. It's the, as I said before, it's the only pattern of hypothyroidism that can be managed with HRT unless there's an underlying autoimmune component. Over 90% of the people have an autoimmune component for it. You can have a high TSH on a blood test. Conventional medicine is typically HRT, but they don't screen for Hashimoto's because it doesn't change their treatment. Functional medicine, we look at nutritional support for the thyroid. We rule out autoimmune conditions, and then if we pick up an AI condition, we want to help try and settle that immune system down before there's too much tissue damage. Secondary hypothyroidism, secondary to pituitary hypofunction. Fancy words for the pituitary is not talking to the thyroid gland, telling it what to do. The pituitary is fatigued. It's making less TSH, so there's less TSH for the thyroid to respond to. Why is that happening? Biggest one is stress. Stress from an active lifestyle, stress from our environment, stress from our diet, inflammation, infections, all those stresses help set that up, as well as postpartum depression. We'll see that a lot in women after after delivery, where that thyroid starts to shut down. Here they'll try to give people thyroid hormone to fix it. It doesn't work because the pituitary just has the whole system shut down. Or they might just not do anything and just wait and see how things turn out. Functionally, we rule out autoimmune, we look for infections, we test for stressors, we support the adrenal glands, we support the pituitary gland. You kind of get the idea how we're working here. You know, thyroid underconversion. So the thyroid gland isn't making enough T4. Whoops. Did my slide get mixed up here? One moment for technical difficulties. All right. So a thyroid underconversion, get my cursor in the right spot here. There's a decrease in the conversion from T4 to the active form of T3. So we mentioned earlier, 60% of the conversion from T4 to T3 happens in the liver. If the liver's not doing that job, we don't get that T3 made. Why? Most often, chronic stress increases cortisol, which then suppresses the T4 to T3 conversion. Also, too, you get from the high stress, you can get free radicals attacking the liver, causing inflammation, which further affects your liver function. As well as you can have toxicity, you can have a lot of other issues. And what happens is you might have a low TSH, you might have some other hormones might be off, and medically they either don't do anything or they try hormone replacement therapy to see if it works. Functionally, get ready for the pattern, check for rule out autoimmune, look for stressors and inflammation, help resolve those and support those, support your body to heal. You know, and then also give you things that support T4 to T3 synthesis, which is key nutrients that are needed in high amounts for that conversion that are burned up with chronic stress. Thyroid overconversion, but decreased TBG. So there's too much T3 is being made and it overwhelms the cells. And part of what happens with that one is there's not enough TBG, which means you have too much free T3, so then that's always out there turning those cells on at the inappropriate times. We'll see that a lot in cases of insulin resistance or PCOS in women, polycystic ovary syndrome, or any of people have been using like testosterone creams or hormone creams. We'll see that a lot, especially the women. One of the things is, women have low libido. They give them testosterone creams to, supposedly wake them up, but it's missing the key element in the breakdown of the systems. Conventional medicine, they don't do much, or they might try some thyroid hormone support. Functionally, here we go again. Rule out autoimmune. Deal with the blood sugar. Deal with hormone imbalances. Deal with the hormone detox. Number 5, elevated TBGs, those molecules that carry the T4 from the thyroid gland down to the liver. There's too much of them, so there's going to be too little free T3. Why does that happen? Big one here is oral contraceptives and hormone replacement therapy of the female hormones. Those will increase. They're going to affect the production of the TBG. You're going to have a problem with those. TSH is normal. And so medically they go, wow, you have all these symptoms, your TSH look good, but but they don't measure the other things. That's all they do. Functionally, we're ruling out autoimmune, we're clearing out the excess of hormones in your body, we're providing nutritional support for healthy liver function, supporting the body to start to heal. Number 6, thyroid resistance. This is where you're making all the right stuff, you're making the right T4, you're making the right T3, you're making all the proper ratios, but it gets to the cells and the cells aren't listening. You put the key in the lock and the lock doesn't turn. So that hormones doesn't get into the cell to make the cell do what it's supposed to be doing. What causes that? Big one is chronic stress. Elevated cortisol from chronic stress causes the cells to become resistant to the thyroid hormone. Now we come back to that absolute key of everything. The key to managing thyroid cases is getting the right amount of thyroid hormone into the cell at the right time. Blood tests are going to be normal. Conventional medicine, they don't do a whole lot because really the labs look great. But if you dig further, you rule out autoimmune, you look at the adrenal glands, you get the whole picture, all the pieces of the puzzle, so you can start doing the right things. So quick review. Hypothalamus in the brain talks the pituitary gland by way of thyroid releasing hormone. Pituitary gland talks the thyroid hormone to the thyroid gland by way of TSH. And then the thyroid gland combining TPO with iodine and magnesium and selenium. You make your T4, 93% of that. You make your T3, which is the active part, about 7%. 7% goes out, makes things work. That's the active portion. The other 93% travels to mostly to the liver, some to the gut, some to what we'll call periphery tissues. And there, that conversion happens there as needed to release more T3 out to the cells to turn things on. That whole process can break down in a lot of different places, not just up at the top up there. So remember, the key to good thyroid health is getting enough T3 inside the cells at the right time. So the medical approach, as we've touched on it, medication, hormone replacement therapy. They'll ignore your symptoms. They'll tell you it's in your head. They tell you got to learn to live with it. Or they wait until it gets really bad. And then what happens? We don't know. When it gets really bad, then they can do something. They can cut an organ out. They can give you a new medication, whatever. What makes us unique? We take an integrative approach. Every patient is unique. Every patient is different. Granted, there's a lot of common threads, but we look at each person as an individual on their own. And therefore, if we look at everybody individually, what's that mean is we treat everybody differently. How do we know what to do? Through lab work and applied kinesiology. We ask the right questions, which gives us the right answers to make the right choices. And going back to this web of physiologic dysfunction. Lots of different areas: blood sugar, mind, body, cellular dysfunction, brain function, immune system function, liver function, hormone imbalances, thyroid, gut, adrenals. All of those are things to check and areas that are going to have an influence on the center where is the thyroid, or whatever you might be suffering with. Peripheral neuropathy, nervous system issues, MS, whatever the piece of the whatever part you put in the middle, we look at all of these parts. So a thyroid dysfunction is a sign of a metabolic dysfunction. And to really get to the bottom of that, we have to do proper testing. Proper testing is crucial and it's critical. Otherwise, we're just shooting the dark, trying to figure something out. So proper testing, things we look at, we do a complete metabolic profile. That's going to look like a complete thyroid panel. When I say a complete thyroid panel, that's a lot of tests. We're going to talk about what's specific on that in a few minutes. We look at vitamin D levels. We want to look at the active form. Sometimes look at the storage form. If I give somebody who walks in my door and they are low on vitamin D, and we support them for a while, come back and recheck it, it's not changing. So we have to look at how are they storing or how they utilize it, because sometimes there's more factors that come in with that. We look at anemia. If you have any types of anemia, that can be related to iron, it can be related to digestion, it can be related to thyroid, but it's going to affect oxygen delivery to your bloodstream, oxygen delivery to your nerves and to your brain. It's going to affect how your body works. Kidney function. We look at blood sugar levels. Sometimes look at cerebellar antibodies, not that often, but sometimes your immune system is literally starting to attack your brain tissue. That's actually that's a very significant issue. We'll look at female hormones and sometimes male hormones. Sometimes that's part of the puzzle we have to unwind. Immune panels. We want to look at things like Th1 versus Th2. I'm going to talk about those in a few minutes. Our cytokines are regulatory parts to our immune system. We want to look at the stress index. How are your adrenals working? Your adrenals are a hormone that create hormones that help you respond to stress. If you're under chronic stress, constant stress, your body starts to break down. It starts to show up certain things in the profile. Elevated cortisol, which is the main stress hormone, is going to chew up muscle tissue. It's going to block other hormones from working. Food sensitivity tests. Often we'll use you'll use muscle testing, which I'll demonstrate in a few minutes here. But sometimes we get something complex. We have to do blood testing, figure out exactly what is the immunological response, and then we can start to measure our improvement. Big offenders: gluten, soy, yeast, eggs, milk, and also too gluten sometimes I think can be the gluten itself. I also think too there are compounds in our agriculture system that are very they're bad for us. One of the big ones is Roundup or glyphosate. I have a particular patient friend of mine that when he travels, he's very gluten sensitive, but if he travels out of the country to countries that don't use Roundup in particular, he can have gluten and has very minimal to almost no reaction. So I think a lot of it, when we talk about a lot of our food allergies, and we hear a lot about with kids these days, partially I think it's the food, it's the kid itself, themselves, but also I think it's the quality of our food. The stuff we have on our shelves is not what our grandparents had, and that's a sad statement on things. Sometimes we have to look at stool samples, looking at gut pathology or at good gut flora or parasites and things like that. A true thyroid functional test. This is really important. TSH, that's what's commonly ordered. That gives us, if you notice from our earlier description, gives us a very small piece of the equation. And we look at the total T4, that's that inactive part of the thyroid hormones. The free thyroxine index is the amount that's actually available. The free thyroxine, that's really affected by prescription drugs. So if somebody's on lots of medications, we'll see changes with that. The T3 uptake, that's the part that's taken up and reabsorbed by the TBG. Free thyroxine, that's the actually active part. That's the part that you need present. Reverse T3, that's a part that your body can't use. We talk about 93% is inactive form in the T4 form. But even when you make that active 7%, only about 60% of that actually is used. 40% of it can't be used. That's that reverse T3. And then we also want to look at our antibodies. TPO, TBG, TSH antibodies, TBG levels. All of those give a sense of is there an autoimmune situation going on. I keep saying it over and over again. Over 90% of hypothyroid has an autoimmune component to it. And then if you have autoimmunity to the elements of the thyroid, what's next? You tend to start to attack other tissues, your joints, your nerves, your brain. So it almost seems with autoimmune, you'll go from one system to the next to the next. So we really want to get to the source of what's causing that immune system to be out of balance. So what makes us different? It comes down to the end of the day, I like to say we leave no stone unturned. We look at all the pieces of the puzzle, as many pieces as we can get. I keep on learning new puzzles, new pieces every day. I'm starting to explore the impact of genetics and what we can do with that. So probably by the time, if you're watching this video, by the time you actually come in, I'm going to be talking about your genetics. I'm learning, I could probably recreate this video every 3 or 4 months based on new things that I learn. But we really look as many pieces of the puzzle as possible. unlike if you see your medical doctor, they look at maybe one or two pieces to the puzzle. So what's important to us? Big thing is results. I mean, that's the most important thing. I care, do people get the results that they're looking for? And you know, I have a good success rate. You know, with people with thyroid disorders, blood sugar issues, fibromyalgia, you know, 90% of the people I work with report, you know, significant improvement. You know, I like to say we get everybody feeling great. Some people are just happy that, wow, I can actually walk down the block and not have to go take a nap for 8 hours. You know, that's a step for them. I'm looking for more change than that, but at least that's what some people they're excited about. Why do we get these results? What we do is different. You know, I don't do what everybody else does. You know, as I've mentioned a couple times in this conversation, I've tapped into a group of 800 other doctors that practice this way. So, you know, my status quo is with those guys. What are we doing? You know, if you get in our chat line, it's constantly, I tried this, I saw this patient, we did this didn't work. Anybody have any ideas? So if you hire me, you hire 800 other doctors, which I think is kind of cool. We do comprehensive testing. We use things based on research and on current research. I mean, I remember back in school, I started following some certain speakers. I've started to notice that what they talk about becomes the big thing in healthcare like 5 or 6 years down the line. So I'm paying attention to what they're doing because we're way ahead of the curve of everything. So we do everything based on research. So things we do, the neurologic therapy. You know, we take a neurometabolic approach. We got to start with brain-based therapy. We got to have the brain and the nervous system working. That's what I do as a chiropractor. You know, we look at doing a complete, comprehensive neurologic workup. You know, why is that? Because your brain talks to your thyroid, and if that communication is not happening, we have to work with that. We have to improve upon that. You know, real simple example here. This is your nervous system. You have, to kind of give a little base on the nervous system, you have your voluntary nervous system. That's the part that has me move around, has me get out of a chair, I can drive a car, I can do things that are under my conscious control. The autonomic nervous system is all that automatic stuff that I'm not aware of. And that has two divisions to it. There is the sympathetic division, that's the fight or flight. So imagine the things that you do when you are scared. Heart rate goes up, blood pressure changes, your vision changes, you don't think clearly because you're focused on survival, like all the survival type instincts. Parasympathetic is the flip side. That's the calming. That's where the healing happens. That's where the recovery happens. Now, unfortunately, in our culture, we walk around in a world of stressors that have our sympathetics be overactive. So we're constantly in that fight or flight state. And when we're like that, our body breaks down. We burn through nutrients at a much, much higher level than we would normally. And our body starts to break down quite simply. So part of what we look at in the course of our exam is look at imbalances. We look at the brain activity between one side versus another. When we look at things, we're not saying the brain is bad. You know, that's actually a whole different conversation. I'm looking, is your brain balanced and functioning together? Because if one side's working more than another, we're going to have an imbalance. How do we see that? We look at posture. We look at muscle tests. We look at eye tests. We look at a lot of different things to see where is the brain working and where is it maybe not imbalanced with another part. And then that, if it's not imbalanced, it creates a dysregulation where things just don't fire the way that they should. And it shows up. It'll show up in posture. It'll show up in eye movements. It'll show up in lots of different areas. So this is a really simple example of this. So this is a picture of some parts of your brain. So imagine out here we got your body. That's all your muscles. That's your joints. That's all this stuff out here. Information comes in from your body into part of your brain called the cerebellum. It gets processed by this part of our brain that's very, very, very active. It needs lots of energy. So if you have blood sugar issues, if your brain's starving, problems start right here. Information gets processed, crossed over to the other side of the brain, sent back out to your body to tell your body what to do. Another part of it goes into your brainstem. And it takes one part and turns it up, increases the activity, and then takes another part called your mesencephalon and keeps it turned down. The mesencephalon is that whole fight or flight response. But what can happen is that whole process goes off. Doesn't work as well as it should. This is abnormal. So now we don't have good information coming in. It's either from misalignments and poor function of the joints, it's poor movement patterns, it's dysfunction in parts of the brain. Now we don't get good information coming in. It's not processed clearly. goes out to your body, in a sense, garbage in, garbage out, bad information in, bad results out in your body. Also goes into that part, into that brain stem, doesn't turn down one part, and then the mesencephalon gets away. That's a fight or flight response. It'll get away from us. And then you get that overactive sympathetic response. What causes some of this interference? Simply as a chiropractor, we call it a subluxation, where the spine's not moving properly, causing stress in the nervous system. That can come from physical stresses, come from mental stresses, it can come from chemical and toxic stresses. All of those add up to create what we call the subluxation complex. And that creates that poor information coming into your brain. So altered brain firing creates a lot of different things. At one level, creates pain, back pain, which is common people come to see chiropractors for. But on a more subtle level, it's the chronic pain, the chronic fatigue, migraine headaches, light sensitivity, brain fog, blurry vision, increased sweating, difficulty falling or staying asleep. You know, if your mesencephalon has gotten away from you when you're trying to go to sleep, it's keeping you awake because it's trying to survive. Heart palpitations, heart rate changes, digestive issues, urinary tract infections, you know, high blood pressure. We talked earlier about the fibro fog or the flu-like symptoms. All of those are things that come with poor brain function. Even more things. You know, this gets into more subtle things: depression, anxiety, difficulty scanning pages while reading. If your brain's not controlling your eyes, you're not going to be able to read well. You're going to fall asleep quickly. Just all these subtle things, changes in learning ability, changes in coordination, changes in sensation, changes in balance. All of those are those breakdowns in brain function. So how are we going to, and so looking at neurologically now, how do we look? How are we going to help your thyroid condition? We talked about some of the metabolic stuff. We talked about some of the neurologic stuff. How do we help you? You know, first we do lab tests. We look at where are some causes for things that are poorly regulated. We try and help your body heal from those poor areas of poor regulation. You have to support certain organs. You have to remove certain infections. You have to help your body heal. We repair. How do we repair? Specific nutritional supplementation. We balance your immune system, once again, through specific nutritional supplementation. We deal with the neurological imbalances, of firing in your brain. Get things working better and improve your brain function through oxygen and brain-based therapies. But it's not a magic pill. You know, it's not like we do one thing, we get a magic result. You don't walk in this office for 5 minutes and you walk out. You know, there's work to be done. They've been following this. Once again, there's a little bit of some light at the end of the tunnel. So now I want to get into more specifics of what we can do. You know, all cases we treat with a combination of neurologic and metabolic therapy. You know, we can't do one or the other. It has to be a combination in both. And so neurologic care, what do? We've done the brain exam. What are some things we can do? We do addressing cerebellum and brain function, assisting that area. First of all, your brain needs two things to function efficiently. It needs fuel, that's in the form of oxygen. That's in the form of good nutrition, so it needs a proper fuel coming in. And it needs good activation. And that can come from lots of different things, but you know, life is activating your nervous system. We want to focus on some specifics. We'll do things like vibration therapy. I'll do specific chiropractic adjustments in a certain way to stimulate brain activity. We'll do exercises. Simple balance things, you know, from simple stuff like doing things sitting in a chair, certain movements, to getting them progressively more complex to maybe you're doing things balancing on a ball. Some things you'll do in this office. Let me teach you how to do things at home. Sound is powerful for the ear, for the brain. You might do sound through one ear, a particular type of sound. It might be playing classical music in one ear or rhythmic pulsations in another. That's what we find out during the exam. We look at acupressure for ear points. You know, that's actually, the points in the ear aren't actually acupuncture points. They're connections to the nervous system, so we can have a big impact on brain function by stimulating points in the ear. We'll do, sometimes we'll do warm calorics, which is warm water in the ear. That's really powerful for stimulating the cerebellum. We might do smell. We might have you smell certain things. Visual stimulation. Eyes are really, really important. We can accomplish a lot of work in your brain by working with different eye exercises. And what these things do is they help balance the firing in your brain, restoring normal brain balance. And then when the normal brain balance is happening, now things start to work properly. That processing from the body to the cerebellum to the brain starts to work more efficiently and more clearly. Metabolic care. The goal in metabolic care is to reduce inflammation, reduce the toxic load, and improve your immune function. And how do we do that? We look at a lot of different things. We look at what are the causes to inflammation, toxicity, and poor immune function. Cause number one of toxicity and decreased immune function is acidity. When one of the tests we do with people is to have them take pH strips, which are just little pieces of paper, and they pee on them in the morning. First thing in the morning, normal urine pH should be about 6.4 to 7. That's not happening now. Your body, if it's outside of that range, it means your body's running more acidic. And acid is very stressful. It's hard in your body. It's hard in your DNA. Your enzymes don't work efficiently. You don't carry oxygen clearly. When you have pH issues, you're going to be one of the big buffers for pH is going to be calcium. So you don't have enough calcium in your diet. Where does your body go to? It starts to pull it out of the bones. So now they're telling people to take lots of calcium for your bone health, but really it's not a calcium issue, it's a pH issue. And also too, if you don't have the good calcium present, you don't have the good magnesium present, other trace minerals present, those are some of the key things to help your body work. In particular, you can't accept T3 hormone, the active hormone, into your cells without the presence of minerals. And also too, if you're mineral deficient, you're going to pull in heavy metals and toxic things into your bones. You're going to hang on to them. And also in acidic environments, bad cells love acidic environments and low oxygen environments. So viruses and bacteria and abnormal cells, they flourish in an acidic environment. So what we work at is alkalizing your metabolism. How we do that? Really simple is, oh, by the way, and what causes your system to be acidic? That's going to be the poor diet, the toxins, the heavy metals, the infections, all create that acidic environment in your body. How do you alkalize? A lot of it is diet. We want to hydrate with good clean water. We want to increase the clean vegetables, and we want to have a lot of veggies in the diet. Vegetables are very alkalizing. I use one product. It's called Dynamic Greens. One scoop of it is 20 servings of organic veggies, and it tastes good, by the way. Kids love it. But that's a huge support for alkalizing support, as well as eating a good diet. And then the other main thing we talk about when dealing with metabolic cases is we got to look at, and our biggest tool we use in dealing with metabolic cases is going to be supplements. Obviously we're going to work with diet and lifestyle and changes you do outside the office, but one of the big things we do is give you the fuel to start to heal, to get all those enzymatic processes and biochemical processes in your body working. And that takes good quality supplementation. Now I literally could do a whole 2-hour workshop on what a good and not so good supplement is, but I'm just going to cover some real basics. You want to look for supplements that are made by somebody who has multiple levels of certification, GMP and CMP certified for purity and quality. Because if you probably paid attention, if you've been paying attention to the news, it comes up almost every week. These vitamins aren't good, these vitamins aren't good. We've done testing on things, this vitamin doesn't help a person. But often what they're doing is they're buying stuff off the shelf. And if I look at other things in the news, you'll see that there's lots of vitamins being tested. When they test them, they don't have what's in the label, or worse yet, they have things in them that are not in the label, and you're getting something that's actually bad for you. For instance, you want to be avoiding animal glandular products. Why? Because they're eating toxic food. They're getting pesticides and chemicals built up in their system. Now if you have the animal glandular, you're getting a much more concentrated version of that, and that's not going to be good for you. You want to avoid synthetics or coal tar derivatives. They're just plain, pure and simple toxic for you. And you also want to look at avoiding, you want to look for natural sources as much as possible. Like vitamin C, which has been shown to help prevent cancer. It's a strong antioxidant. It has lots of good health benefits. Is not the same as ascorbic acid. How do you know? Ascorbic acid will not prevent scurvy. Vitamin C will prevent scurvy. Ascorbic acid does not. And worse yet, if you're eating iron-enriched foods, which is that elemental rock iron that we talked about earlier, The ascorbic acid combines with iron in a certain environment and then makes what's called dehydroascorbic acid, which is a neurotoxin. It's a pro-inflammatory. It's not good for you. So there's multiple ways we can look at this. I like to use a real simple test. I'm actually going to use my demo person. If you come on over here. Now we have to sort of adjust to a camera with a small screen, a shorter person, and all these sort of things. So you're probably going to lose the top of my head in this, but we'll get it straightened out later on. So obviously, most of the time I look at labs with a patient. Labs give us a really good sense of where to start. But I like to use muscle testing because muscle testing allows me to refine what's good for a person. When I'm doing that, what we're dealing with is, in kind of a mysterious way, it's a life force of the body. And what's the difference between the cadaver on the table and the person standing up is that missing thing called the life force. Biochemically, I like to think of it in terms of electricity. All of our cells make electricity. We have an electrical field around our body. It has a certain frequency to it. And then what we know from study of mass spectrometry is everything in the world has a certain vibrational frequency to it. That's how they test for things. They can put them in a mass spectrometer, do whatever things they do in those things. They get a readout of what the frequency of that compound is, and they know what it is. So I'm just kind of using that as a way to assess things. So a healthy person is going to have one kind of field around them. An unhealthy person can have another one. Healthy organs create one field. Poor quality organs create, or poor health organs create other fields. So we're just going to work with some of that. So it's really simple. Just do a muscle test. I'm going to press down. I'm using just light amount of force. Now I'm going to give her something in her environment called, you might be familiar with this, called Glade. Now, if you look in the label of Glade, there's a lot of really nasty stuff in here. In fact, I looked it up this morning. There are about 4 or 5 compounds that contribute to allergies, immune issues, and worse yet, there's synthetic hormones that create lots of hormonal issues in women. One of the reasons why we're starting to see younger and younger ages of puberty in young girls. Sometimes 9 is not uncommon. 4 is becoming even, unfortunately, more noticeable. So, by the way, don't use these around your kids. We're going to show you why. Hold nice and strong. I'm going to put this near her, and she can't hold up. Now, you might go, but doctor, you're pushing harder. I'm going to use one finger. Hold, and hold over here. You might conclude this might not be a good thing for her. I'm going to have you hold on to that. I hope you can see it in the camera. And I'm going to give her a nutritional product I use for helping the liver upregulate its ability to clear out toxins. This is called OptiCleanse. And then just hold here nice and strong. Now I'm pushing really hard. Now it's a lot easier to hold up, isn't it?
Yeah.
So we have one thing, something bad for you, and then bring in something good. Now this is something we can put the arm down, that I think everybody should be on as a constant, ongoing detox support. My 4-year-old daughter has been on this pretty much since about a year old. She likes these things. But this can help us not only clear the body to heal, but deal with the ongoing insults we deal with every day. So now we take another little slant to it. You can use acupuncture points. Acupuncture points in the body relate to different organs. So we're going to use one related here to the stomach. Now you probably can't see it on the camera, but it's right below about 2 inches below her xiphoid process. And hold, and I'm going to push down. Not a whole lot of power there. I know from her history, I know from her lab work, she has some digestive issues. We're combining ideas here. I'm going to give her a sample of a digestive support. Hold here nice and strong. We're going to talk a little bit later on what this is, but this is going to be increasing the hydrochloric acid in your stomach. Hold nice and strong. Now, she's doing pretty good with that. Now, I like to refine this a little bit. We'll take what we call polarities. This allows me to find out what's really good for a person. I'm going to have you hold this with 2 fingers and your thumb. And hold nice and strong. Oops, we got to keep on the reflex there too. Now it's a little bit tricky. Actually, why don't we do this? Why don't you hold it? I'll hold the reflex for you.
Okay.
Oh, there we go. And hold. So she's got 3 fingers on. She's pretty good. Now go to, then go to 3. Now 3. Now go to 4. And hold. She doesn't quite hold up on 4. So this is pretty good, but if I can find better, I like to. So we're going to give her another product. Just go straight to 4. And hold nice and strong. So I like to see things above 2 on a polarity scale. She had a 3, now she's got a 4. This is something I would give her to help support digestion. Now, talking about quality of supplements.
Vitamin D. Vitamin D is really helpful for a lot of different things. In fact, vitamin D should turn any reflex in a person's body that's off, just should turn it back on. I happen to know from her lab work, her vitamin D is low, so we should see something happen here. 2 fingers on that reflex, and hold again. Absolutely no help. As a matter of fact, just hold the vitamin D. Hold. Reacts kind of like the Glade does. Now this is just, I went into the local health food store, said give me the best vitamin D that you've got. Ironically, it was the most expensive. And this doesn't work for her. So now we're going to try a different vitamin D. We'll go straight to here. Let's try polarities first. Let's go straight to 3 fingers. And hold. Let's go to 4 fingers. And hold. Okay, we have a good one for her. Let's check something else. This is another type. And hold. Good. And then 2 fingers on there, or 4 fingers. Good. Works good. Now I go, wow, they're both pretty good. Now we look at what's the best price point. But I always look first at what's best for the patient. Let's try one other thing. There's 3. Go straight to 4. How nice. We have 3 good vitamin Ds that work for her on all polarities. Now we get a choice. Now we can look at what might be the least expensive. I always look for what's the quality first and the price second, because I always want what's best for my patient. There's one thing I want to do here, I thought. Nope, I got it covered. Very good. So there's our little idea of how we refine and focus down what I'm going to do for supplements to help support somebody on a neurometabolic case. So I'm done with you. Thank you. If you could please retune me in the camera so people can see me. All right, great. Okay. So now we want to look at cause number 2 of inflammation, toxicity, and poor immune function, and that's free radicals and excitotoxins. You know, long before you developed a health concern, long before you had any symptoms or complaints, you've been being exposed throughout your entire life to heavy metals, toxic chemicals, poor nutrition, you know, leading to free radicals and excitotoxins. So free radicals are things that they oxidize your body. Think of rust on a nail. That's oxidation. In a sense, if you have oxidative stress, your cells are rusting. How's that sound? You know, so those can be toxins, they can be nutrient deficiencies, they can be poor quality nutrients. As I mentioned earlier, combine ascorbic acid with rock iron in a certain environment in your body creates pro-oxidant things which aren't good for us. They damage our DNA, damage our cell membranes, have us age faster than we should be. They can be heavy metals. You know, they can be amalgams from mercury from the amalgams in your silver fillings in your mouth. They can be fumigants. They can be deodorants. They can be all sorts of different things. And then you get the excitotoxins. Those are compounds that cause, in the long term, cause neuronal cell death. They cause your nerves in your body to die off. Big ones in our environment these days are things like MSG, NutraSweet, our artificial sweeteners, you know, the Splenda, sucralose are all nasty, nasty neurotoxin excitotoxins. And then you combine them with aluminum, sources of aluminum in our cans and our canned goods and our deodorants. They'll combine with those compounds and really ramp up the negative effect on you. So you want to reduce those. You want to handle those. Cause number 3 of inflammation, toxicity, and poor immune function is going to be the infections. That can be a wide range of things. Sometimes they're easy. We can do lab work on a person and we see, wow, we have elevated lymphocytes. We have elevated neutrophils. We know we have an active infection. Then we have to figure out where it's coming from. You know, maybe a person might need antibiotics. But often what's a little more sneaky, you know, we're dealing with a lot now is called biofilms and cell wall resistant bacteria or cell wall deficient bacteria. Those are things that have changed, and now what happens is a couple of different aspects to it. They can not have certain proteins on their cell membrane, so now the immune system can't identify them and it can't destroy them. So now you have this active infection your immune system can't deal with. The other tricky ones, and Lyme's disease is a really good example of this, is it starts to shift where it will create proteins on the membrane of the Lyme's bacteria that mimic or very similar to your body proteins, so your immune system doesn't recognize them. Or when it does finally recognize them, then it starts to attack them. Guess what else it attacks? The tissues in your body, autoimmunity. So infections we deal with can be Lyme disease, can be parasites, can be infections in the gut, can be what we call H. pylori, which is a big contributor to GERD and heartburn and ulcers in people. It can be dental infections. If you've had root canals or had crowns, most often it's really difficult to clear out the bacteria. So they seal it all off and you still have an active infection going on. I developed an abscess on my wisdom tooth, and I walked in and I went, the surgeon looks at me and goes, "What do you want? Should I pull it or should we do a root canal?" I looked at him and says, "I don't want it. I pull it out." He goes, "That's actually a really good choice." So many oral surgeons are starting to notice that there's a problem. So now we want to get into cause number 4 of inflammation, toxicity, and poor immune system is autoimmunity. This is a big topic, so I just want to cover some basics to it. And start out with a little bit of a conversation about the immune system. And actually I was taught a really simple analogy that kind of explains a real complex topic. And we like to use the analogy of a medieval kingdom. In a kingdom, you got the kingdom, you've got the castle, and in the castle you have the king. The king is known as Th17. Don't worry, we're not going to quiz you on this. But Th17 is like the main control part for the immune system. So it's like the king who sets the policy for the kingdom. Says who the bad guys are, says who the good guys are. Communicates that out to the walls of the castle, and there's the general. The general is called Th3. Th3 communicates that policy, in a sense, out to the foot soldiers and the archers out in the field. They will fight off the bad guys. Identify who the good guys are, identify the bad guys, destroy the bad guys. So that's Th1 and Th2. So we got Th17 is the king, Th8 sets the policy, Th3 communicates to the Th1, Th2, it tells everybody who the bad guy is, and that's how it should work. Now, imagine that the foot soldiers are incompetent. They can't do their job. You got a problem. Imagine that maybe you have good foot soldiers, but the general can't do his job. You got a problem. Or imagine the king has gone nuts and is ordering everything attacked, and that's what autoimmunity is usually when the king and the general break down completely. Now, it's very oversimplified. Somebody who is an expert in immunology would probably disagree with many things I said in there, but that really covers the basics of how your immune system works. And your immune system has 3 major parts. One is the natural barriers, like your skin. There's enzymes and things in your skin will help keep infections from developing. There's your lungs. You cough and you sneeze and you blow stuff out of your system so it doesn't take up residence. Your eyes create the tears with the enzymes that helps kill off what you might get exposed to through your eyes. Mucus, the respiratory tract, that helps trap pathogens and viruses and bacteria so you can cough them out. And your gut flora. Gut is huge. Between 70 and 80% of your immune system is gathered around your intestinal tract. And there you have your immune system gathered there, so there's lots of activity, and the good bacteria in your gut help fight off the bad guys. So gut health is really important. I don't think I've dealt with a single person in 20 years with autoimmunity we haven't had to start with healing the gut. It's really critical. You got the natural barriers. Number 2, we got the Th1 and Th2 white blood cells. Those are, in our kingdom analogy, those foot soldiers. The Th1's like the Pac-Man. That munches up and destroys the bad stuff. Th2 is, in a sense, the memory. So example, sometimes you get sick and you're sick for about a week. It takes the immune system about a week to develop the full ability to fight off an infection. And then the next time you get exposed to that same thing, you either don't get sick or you're sick for a short period of time as your immune system kicks in and does its job. So that Th2 is important. And what can happen is, at times you can get dysregulation, and that's when things aren't imbalanced. We're going to talk about that more in a minute. The Th3, that's so we've got the first part, which is the skin, the eyes, the gut, and all of that. Second part is a Th1, Th2. Th3 balances the communication between everybody, and often when somebody's autoimmune, it's a breakdown in the Th3 or the Th17. So what would trigger your immune system to start doing things the wrong way? What triggers autoimmunity? What triggers the immune system to be out of balance? One is dysregulation, where the immune system is out of balance, dysregulated because of certain stressors. That can be things like chronic inflammation from poor diet, from poor fats in our diet. That can be blood sugar control issues. That can be chronic stress and elevated cortisol. That could be hormonal imbalances, neurological imbalances. Pregnancy is a big. I mean, obviously your immune system has to shift to protect the baby, but once the baby is born, it has to shift back to balance. And often I'll see a woman patient says, you know, I felt great till I had my first, second, third, fourth kid, and then I just never bounced back. That immune system never restored itself. Also, low levels of vitamin D can contribute to immune system dysregulation. You know, medically, they want to see people above 30. I like to see people between 50 and 100. A lot of the cardioprotective, neuroprotective, cancer protective effects of vitamin D kick in around that 70 to 80 range. And you know, I've seen people in the office with as low as 6, and that's really in bad shape. Another thing that can contribute to dysregulation of the immune system is pH issues, poor regulation of the pH in your bloodstream. Also, what causes dysregulation is active infections, active antigens. You know, your immune system is being unbalanced because there's an invader. That can be a chronic infection, be it the bacterial or the viral or a mold. That can be an infection in the gut or parasites. It can be food sensitivities. You know, the big common offenders these days are wheat, soy, dairy, and wheat, soy, dairy, and corn are some of the big offenders. And it can be any food, but those are some of the big common ones. It can be environmental toxins. We walk around in a sea of toxins, and if they can be big immune system stressors. And leaky gut syndrome is another part of that poor digestion, that immune system stress, where, in a simplified effect to it, the cells in the walls of the gut, in a sense, get spread apart due to many different things, allows larger proteins in your bloodstream. Your immune system has to attack them. It gets overworked and overstressed. So how do we know? How do we know what would trigger it? We do the proper testing. We look at muscle testing. We look at lab tests to figure out where in this puzzle things have gone awry, and we start doing things to help heal it and repair it. You know, this comes in really big in management and support of people like Hashimoto's or Graves', which are autoimmune conditions. You know, we got to look at removing the antigens, clearing up the dysregulation, modulating the immune system, supporting with common things like vitamin D, glutathione, good fish oils, and other nutritional support to help rebuild and heal your body and get it back working the best that it can. Once again, we got to do the proper testing. You know, and as I said earlier, 80% of your immune system is gathered around your gut. And one of the biggest problems I see in my patients, almost number one, whether you're walking with back pain or thyroid disorder or fibromyalgia or blood sugar issues, whatever it is, one of the biggest problems I see is hypochlorhydria, hypoacidity. Now, we're going to take a step away from the common advertising programs from drugs like Prilosec and Zantac and things like that. You know, if you look at any physiology textbook printed before the year 2000, almost everyone looked in, there's one paragraph. If you read that paragraph, you see that all those drugs are barking up the wrong tree. They're working things the wrong way. And here's basically how your body works. And by the way, books seen after that, that paragraph isn't in there, or the information is covered, but it's spread all over the place. It's hard to pick up. Here's basically how your body works. You take water and turn it into very strong acid. Usually pH about 1.5 to 2 is what's normally should be in the stomach. That's a really strong acid. And it takes a lot of energy to do that. So if you have energy production issues for many different reasons, chronic fatigue, infections, poor nutrient status, whatever it might be, if you're not making the energy, you're not making that strong acid. In a normal situation, there's a ring of muscle at the top of your stomach and there's a ring of muscle at the bottom of the stomach to stay nice and tight. Keep those contents in the stomach. But what can happen as that acid weakens, getting down to pH of like 3, 3.5 to 4, still, a fairly weak acid relatively, but those rings of muscle relax and allows those contents to get out in place where they shouldn't be, in delicate tissue that's not protected, and you get the burning, you get the GERD, you get the heartburn, you get all that nasty stuff. So in the world of the pharmaceutical industry, they want to push that stomach acid down further. Now here's the problem. With lower pH, you lose the first part of your immune system. Your immune system does not destroy the acid doesn't destroy the bad stuff. That's why you can have two people who eat the same food. One person gets food poisoning, the other person didn't. More than likely, the person that didn't had adequate hydrochloric acid in their stomach. So one of the first things we do, paradoxically, we look at the labs. We'll look at the lab work. We might see total proteins off because you can't digest things. Globulins off. You can't digest your food. Phosphorus is going to be off what it should be normally. And that's, so we pick that from lab work. We also look at the applied kinesiology like I did with the patient a few minutes ago. We check stomach reflex. It's off. Look at the history. We probably have digestive issues. But then what we want to do is give them good support. We want to give them hydrochloric acid support. Now, I want to pause. Do not go out and go drink a bunch of hydrochloric acid. Please do not do that. You can use apple cider vinegar is okay, but really we want to actually support and rebuild that. The only exception to it is we want to make sure there's not an ulcer. How do we know? If we start doing the support and we get more heartburn, we got to back up and look at what might be going on. So you might have an H. pylori infection. Then we have to look at, do we have to get you some antibiotics, or can we deal with it from an herbal perspective? Now, I work a lot with healing that with people so they actually don't have to rely on the pharmaceutical drugs anymore. And really, we're looking at a $40 billion industry, so there's a lot of marketing to get you to think, oh, heartburn, I need to go grab the little blue pill. Now, another common thing I'll see is it's a real popular thing these days to use alkaline water, or alkalized water. And you want to alkalize your physiology. You do not want to alkalize your stomach because you are shutting down the first line of digestion and the first line of your immune system. So don't use that. Another big important part with the hydrochloric acid in your stomach is it's not only the first line of defense for your immune system, but also creates methyl groups. And methyl groups are really cool because they will, when they're present in the normal amounts, they will keep your DNA from expressing bad things. They have your DNA more express the good things. If methyl groups start to get depleted in your body, you start to express the bad aspect of the genes, whatever that looks like. It might be weight, it might be cancer, it might be whatever it might be. The bad genes get turned on in the presence of low methyl groups. So we definitely want to start out with digestion with our patients. Now, we've thrown a lot of information at you in this video. And you might, and I want to let you know there is a light at the end of the tunnel. And you're kind of left at this point in the conversation, hopefully with some hope. Like, wow, I've been doing something one way, and I just saw a whole new avenue. There's a new pathway I can go down to. And my job is, if you become a patient in our office, to be your coach, to be your guide, to help create that new pathway with you and support you going that direction. So, I told you at the beginning of the video, I would give you the first step you can do to get yourself back in the road of the wellness, and that is make an appointment in our office. Come into our office, and here's what we're going to do with you. Come in on our first day. We're going to do almost a complete neurological exam. I don't do all of it because we save some for later because we don't need all the information up front. But also going to look at any existing labs you might have, any existing labs that can last 30 to 90 days. If they're more than that, they don't have a lot of value for me. We're going to do a full neurometabolic assessment form, a neurotransmitter assessment form. With neurotransmitters, which those are the chemicals that make our nerves work, there's not really good tests for it. The best way to look at it is doing some questionnaires so we can get an idea of the health of your brain, the health of your nervous system. And why do we want to look at the health of your brain and nervous system? Because that's what drives the whole system. We really highly encourage you, if you have a significant other person in your life, whether it's a spouse, husband, significant, boyfriend, girlfriend, whatever it is, if you have someone in your life who you make decisions together, I really recommend they're here with you on that first visit. Why is that? If we work together as a doctor and a patient, we're going to have a lot of recommendations for you, things you need to do to change your lifestyle. And I've done it solo before, and it's hard. When the other person in the house isn't on the same page, it's really hard. And I'll even admit my compliance is not that good. Having somebody in your environment who's in your corner, who's helping support you, can be really, really important to get you through that first period of time as you create new habits for your lifestyle and for your health. we have you come back. If we accept your case, we'll review it with you. We're going to overview any additional testing that has to be done. We're going to go explain what we found during your exam, what it means, both neurologically, biochemically, metabolically, so we can start to put together the plan that's going to work for you. Then we'll actually go over that type of plan with you, review that plan, and then talk about the financial obligation. Now, I said at the very beginning of the conversation, often what comes up is insurance. And I talked about it earlier. Insurance will cover your drugs, it'll cover your surgeries, but it's not going to do much about the things you need to do to actually get well and get healthy again. So as I tell all my patients, if you can afford between $200 to $400 a month, we can almost always make care work for you in this office. But first we have to find out, do we think we can help you? And for this visit here, we really strongly recommend that you also have that significant other person with you again also, just so they can see what we're doing, see the direction we're going, they can be a support to you. So my offer, I extend an offer to all my patients. Now, when you see this video, if you've seen this video, I only accept about 4 or 5 thyroid clients per month. Why is that? Because you're a lot of work. Nothing personal, but you're a lot of work. There's labs to review, there's cases to put together, there's a lot of thinking going to supporting your case. So I only accept about 4 or 5 per month. And if you are watching this video, let you know my normal visit for the cost of the first 2 visits is $450. But if you're watching this, we'll give you those 2 visits for $75, the first 2 visits. And then from there, if I feel like, if at the end of that time and I feel like I actually can't help you after those first 2 visits, like I look at you, your case isn't helpable, I'll let you know and I'll refund you the $75. So all you've lost is some time. And that's my commitment to actually help people get back on the road to wellness. Now there are some rules, okay? Rules make the world go around and they make the world workable. Rule number 1 is you must be committed to getting better. You got to have a commitment, at least a 9 or a 10. I can work with an 8, and we want to find out what stops, if you see things that keep you from being a 9 or a 10, if we can work with that. But really we want high commitment people because that's where the results happen. You must be prepared to make some lifestyle changes. If you think about it, everything you've been doing up until now has got you the way that you are. And sometimes we got to do a radical makeover on your lifestyle to start getting you healthy. And you must be willing to take responsibility for your own health. Sometimes I have people come in and they're talking about, there's this whole victim mentality, like everything is not their fault. The world took them down. And in a sense, yeah, we live in a pretty crazy, toxic world. That is a fact. But what goes on between your ears is really important. I can actually test a person and find out, do they believe they can be healthy or not? And we can work with that. If it's a no, we can work with that. But having your commitment and willing to be responsible for your health is really critical. We talked a little bit about the insurance. Insurance may contribute a little bit to your care. And we also strongly recommend that you bring along a person with you, an important person for you. And you must understand the condition you have is chronic. It may never get completely better. It may never get completely resolved. But our goal is to get you doing better than you are now. More energy, feeling better. Our goal is to make improvement. Unfortunately, some conditions can't be fully healed. There's the reality, your body's gone too far down the wrong direction, but we can still support you and help you and have those last, the remaining weeks of your life, remember from the very beginning, those remaining weeks go in a different way than they are right now. So, and you want to ask yourself 5 key questions. This kind of crystallizes all of it. You want to ask yourself first off, on a scale of 0 to 10, 0 being you could care less, 10 you are completely committed, what's your desire to getting better? Have you kind of given up? Do you think nothing can change? Or are you like, I'm ready to go, I just need somebody to show me what to do? That'd be a 9 or a 10. And you want to look too, how have these symptoms affected you? How have they affected you personally? How they affected your job, your relationships, your family, your finances, your recreation? Like how is it constricting you, and what's it cost you? What's been that cost? What is it, in time, in money, in happiness, in sleep, in rest, in enjoyment? What's been the cost of all of it? And here's the really important one to look at. If you keep doing what you've been doing, what's the future going to look like in 3 or 4 years down the line? What do you think could happen if you don't take care of it? And what is it worth to you to improve upon your condition? You want to ask yourself those 5 questions. Then if you're have good answers to that for yourself, give us a call. Our number is 763-600-1682. If you're watching this off of Facebook, you can PM back to us on an instant message. You'll hear back from us within a couple of hours. We'd love to work with you. But I want to thank you for the time that you've taken to watch this. If you've gotten to the end of this, you watch a lot of information. You might want to go back and watch it again. And I thank you for taking the time, and I look forward to meeting you in the future and helping you out. Thank you very much.